everybody. Welcome to Ask Dr. Bob. This is where you ask me, Dr. Bob Gabbay, the Chief Scientific and Medical Officer here at the American Diabetes Association, your questions related to diabetes. And if you're new to this program, welcome. And if you're a long-time listener, great to have you back. We're going to, each month we pick a different topic. And this time we're going to talk about type 1 diabetes and also who's at risk for type 1 diabetes and a bunch of useful information there. So if you like this, tell your friends, family, loved ones. Follow me on LinkedIn where you can find lots of more information. And there are old episodes available on our American Diabetes Association website as well, so you can see some of the past ones. Okay, without further ado, let's jump right in. And first question is really a perfect level setting. So what is type 1 diabetes? So you've heard about it. It's, about 5 to 10% of all people with diabetes. And what it is it's fundamentally an autoimmune disease. Autoimmune means that your immune system attacks your own body. And here specifically what it attacks is the cells that make insulin, the beta cells and the islets in the pancreas. So it destroys the ability to produce insulin, and over time, the only treatment is to replace insulin, either with injections or an insulin pump. But the treatment is really about insulin. And we'll talk in a moment of some stages that people go through, and that's sort of newer stuff for those of you that have been following this world for a while. So we'll get into that in a second. But the other important thing to keep in mind is we used to think type 1 diabetes was largely what kids got. It was the diabetes that kids got. Well, no longer true. Type 1 diabetes can happen at any age. And I actually see a large number of patients that have, 60 years old and diagnosed with type 1 diabetes. So it can happen at any age. All right. How could I know if I'm at risk for type 1 diabetes? And that's sort of going to be a theme here. And you'll see why in a little bit, because there's some new things in this area. Well, first of all, who's at risk for developing type 1? The biggest risk factor is really genetic. If you have a family history of type 1 diabetes, so if someone in your family has type 1, you have an increased risk of developing it. If you're a parent and you're wondering, oh, I have type 1 diabetes, what about my child? Well, they only have like a 5% risk of developing type 1. So most likely they won't, but what if you're worried? What if you're concerned? What if you want to know what your risk is? Anyone with a family history, I'll tell you how you can get tested for that. After family history, that's like the number one risk factor. The other is if you have an autoimmune disease already, some other autoimmune disease, then you're somewhat more likely to develop type 1 diabetes. So we talked about screening. So how would you know whether you might be at risk for type 1 diabetes? And there's specific blood tests that you can have done that will tell you. And what they're measuring are autoantibodies, antibodies that your body makes to yourself. And there are 3 of them to keep in mind. And they have sort of a little bit of obscure names. But I'll repeat them a couple of times in case you want to jot them down. And of course, through technology, you can rewind if you need to. The first one is anti-GAD, G-A-D. So that's one of the antibodies. The other is islet antigen 2, or IA2. So it's anti-GAD, IA2, or zinc transporter 8. I said they weren't really user-friendly ways of describing it, and ZNT8. So it's those 3 antibodies that you can have done in most labs, and that will tell you what your risk is. So if you have a family history of type 1 diabetes, it might be something to consider getting tested for to see what your risk is. So the next question is, what if a person tests positive for one of these antibodies, What does that mean? Well, if you have one antibody, you have a little bit higher risk, but you may not develop type 1 diabetes. If you have 2 or 3 antibodies, you're likely going to develop type 1 diabetes sometime during your life. And that's why testing is important. And I'll get to this in a second. There's something you can do about it. That's the other reason. So if you get tested and you have one antibody, you might want to just talk to your healthcare professional about repeating that somewhere down the line, because sometimes you'll develop that second antibody. If you have 2 or more antibodies, well, now what you want to do is figure what stage you're in. And turns out the type 1 diabetes has 3 stages. So stage 1 is where you have multiple antibodies, but your blood glucose levels are normal. So you have the antibodies, meaning that the autoimmune process is happening. It could take several years to develop type 1, but your blood glucose levels are normal. So that's stage 1. What about stage 2? Stage 2, you have the antibodies, but your blood glucose levels are abnormal. They're not quite the level of having diabetes. They're not that high, but they're abnormal. They're not in the normal range, whether that's measured by an A1C blood test or something called an oral glucose tolerance, where you drink a sugary beverage and have a blood test 2 hours later. So there's certain cutoffs there that sort of say definitely normal glucose, stage 1, abnormal glucose, but not the diagnosis of diabetes, meaning an A1C is 6.5 or over, or stage 3, antibodies and your blood glucoses are in the diabetes range. You have classic type 1 diabetes. So those are the 3 stages. And so why do I need to know these stages? What's this all about? Well, it turns out that we have some treatments to consider. And this is sort of an interesting story. So, the National Institute of Health, as you probably know, funds research of all kinds, right? They're the largest funder of biomedical research in the world. And there's been this effort called TrialNet. Some of you may have even been in this study, because really thousands of people over the last 25 years that have been in these studies. And what they've been doing is screening people for type 1 diabetes and trying different treatments to see if they can delay the development of type 1. So people in that stage 2 phase, where glucose is somewhat abnormal, but not to the level of type 1 diabetes. And they've tested literally dozens of different treatments over the last quarter century. None of them worked until one. And now we have one that will delay the development of type 1 diabetes by 2 to 3 years on average. Some people more, some people less, but on average 2 to 3 years, which is not insignificant. If you could go 2 to 3 years without having type 1 diabetes, hey, that's worth considering. So this medication is called teplizumab. And again, something that you would talk to your healthcare professional about. So let me back up here. So we say there are certain people that are at risk. If you have a family history of type 1 diabetes or an autoimmune disease, you could get tested with these antibodies. If you've got 2 antibodies, well, then you need to know what stage you're in. You have totally normal glucose stage 1, abnormal stage 2, or actual type 1 diabetes stage 3. And then you have the decision, if you're in that stage 2, whether you want to explore treatment or get involved in the TrialNet study that's testing other new treatments. So something, again, to talk to your healthcare professional about. So here's where the other question that comes up is, so I have these antibodies and I don't have, type 1 diabetes right now. What should I do? Well, probably the most important thing, if you have 2 antibodies, meaning that sometime you'll develop type 1, is to learn a little bit about it. learn about what the signs might be. How would you know? Excessive urination, excessive thirst, and maybe even learning how to check your blood glucose levels, just so that you know when it happens, you catch it early. Because type 1 diabetes, if not caught really in the earliest stages, typically people get really sick and end up in an emergency department, and that's often the first time they find out they have type 1 diabetes. So if you have if you've tested for antibodies and you have 2 antibodies positive, probably learning more about diabetes, being aware if you have these symptoms, to go see the doctor, go see your healthcare professional right away to catch things before you get too sick. And it's then knowing this early can prevent you from being hospitalized. So it is worth sort of screening, even just for that purpose, to know that you're at risk and prevent yourself from ending up in the hospital with something called diabetic ketoacidosis. So wow, we've covered a lot of ground here, and I'm just going to try to recap. So type 1 diabetes, autoimmune disease, destroys the cells that make insulin. The only treatment ultimately when you have, let's call it full-blown or stage 3 type 1 diabetes, is insulin, either an injection or now actually there's an inhaled form of insulin or an insulin pump. Who's at risk for developing type 1? People that have a family history, someone in their family with type 1 diabetes. Or somewhat less likely, but still an increased risk, is if you have an autoimmune disease. There are 3 stages. And screening is checking the antibodies. If you've got 2 antibodies, high likelihood at some point you will develop type 1. And then the key is figuring out which stage you're in. Normal glucose and antibodies stage 1, abnormal glucose and antibodies stage 2, and really high glucose stage 3. And for those that are in that stage 2 zone, there is an FDA-approved medication that can delay the development of type 1 diabetes by 2 to 3 years, called teplizumab. Meanwhile, for those of you that are interested in research, what's coming down the pike, well, they've continued to test other ways to intervene to prevent people from developing type 1 diabetes. And so there've been a variety of immune treatments that change the immune system. That's one type of therapy, and that's exactly what teplizumab does. And also, interestingly, there's some information. There's a study showing that verapamil, a blood pressure medicine used, to treat hypertension, also can delay the development of type 1 diabetes. Not FDA approved, don't start taking it or anything, but know that they're testing other things as well. So that was a lot of information. Feel free to rewatch the episode, share it with your friends. This has been Ask Dr. Bob with me, Dr. Bob Gabbay, Chief Scientific and Medical Officer here. Please spread the word so that we can make sure everybody can live healthy with their diabetes. And today we focused on who's at risk for type 1 and what you can do about it. So see you next month.